Hi everyone, my name is Dr. Sarah Bjorkman and I am an OBGYN. And I am also 11 weeks pregnant.
And I'm her husband. I'm Dr. Kurt Bjorkman and I am a pediatrician.
And we are documenting this pregnancy journey while creating this YouTube week-by-week pregnancy guide for mamas to be.
And for their partners. Every week bringing you information about what's going on with pregnancy and also what's happening with baby's development.
We are covering everything to have you prepared for labor, birth, and that postpartum journey.
Yeah, and so this week we're going to be talking about a very much requested topic, exercise in pregnancy. All about how to maximize the benefit for mom and baby while also not putting either at risk. So stay tuned for what's coming next. In hearing from all of you, both on YouTube and Instagram, we've had so many questions about exercise in pregnancy.
Yeah.
Is it safe? What should I do? How often? What are the benefits anyway? And it's completely understandable why there's so many questions about this.
And there's a lot of information out there on the internet about exercise in pregnancy, and some of it's good evidence-based and some of it's not. So today we want to give you the facts so that you are equipped with the most evidence-based and up-to-date information about exercise in pregnancy so you can maximize the health benefits for you and for baby. But before we get to that, let's hear an update on what is happening with baby's development during week 11.
So it's week 11 and baby is already starting to look like, well, a tiny human and is about the size of a lime or 4 centimeters in length. By this time, baby's developing eyebrows and has started to pee. It's really interesting in that the pee actually makes up most of the amniotic fluid that surrounds baby, that baby swallows and breathes in to help develop the lungs.
The most important take-home message from this episode is this. Physical activity in pregnancy is the #1 best thing you can do to help reduce pregnancy complications and to improve maternal physical and mental health.
Yeah, so that's a big statement, but it is 100% true. So exercise in pregnancy isn't just something that we should think as a nice thing to do,
Right.
but rather as a must-do critical therapy to improve outcomes for mom and baby.
Yeah. So we're going to start this episode by sharing with you some of the incredible things that exercise, when done appropriately, can help to do for mom and baby. And we're going to show you what the evidence says about how to maximize those benefits.
And so for all of this, we're going to bring you information directly from the American College of Obstetrics and Gynecology, and also a huge review of 675 unique scientific articles that was used to formulate the Canadian guidelines for physical activity in pregnancy.
So by following these guidelines, it is associated with some amazing benefits.
Yeah, and specifically for a baby, there can be fewer complications like being large for gestational age.
And in terms of maternal benefits, there is an association with a decreased risk of pre-eclampsia, gestational hypertension, gestational diabetes. There is a decreased risk of needing a C-section or an operative delivery. And it also lowers the risk of urinary incontinence as well as excessive weight gain during pregnancy. And it helps with that weight loss after pregnancy.
And this list of benefits just keeps on going for things like improved blood sugar control for moms who are pregnant, decreased total weight gain during pregnancy, and also a decreased risk for depression during pregnancy or a decreased severity of depressive symptoms experienced. So we, of course, know all of these amazing benefits of exercise in pregnancy, but that doesn't mean it's always easy to do. And so as a partner in pregnancy, my job is now to be encouraging and enabling for us to both go and be physically active together. And oftentimes that means, hey, let's go make sure we get our workout in for the day. But sometimes we're still human, and it means, yes, of course, I'll drive you to go get ice cream.
So what are the actual recommendations for exercise in pregnancy?
So to make it as simple as possible, we're going to keep our list to 6.
Recommendation #1, All women without contraindications should be physically active throughout pregnancy.
Yeah. So women with these absolute contraindications can still participate in their activities of daily living, but should not do more vigorous activity. If you're a woman with a relative contraindication, it's good to sit down with your OB provider to discuss the advantages versus disadvantages of participating in more vigorous exercise.
Definitely. Recommendation number 2. Pregnant women should get at least 150 minutes of moderate intensity exercise every week to achieve those clinically meaningful health benefits and reductions in complications that we were talking about.
And if you're wondering how do you classify moderate intensity, there's a couple of good ways to think about this. The first is just as simple as measuring your heart rate. And this table can show you some heart rate specific guides for measuring intensity of a workout in pregnancy. Another good method is the talk test. And as this implies, if you're not able to comfortably carry on a conversation doing the level of activity you're at, you should try to reduce just a little bit so that you can do this.
Recommendation number 3, that physical activity should be accumulated over a minimum of 3 days per week, but daily activity is strongly encouraged.
Recommendation number 4. Women should work to incorporate both activities of aerobic exercise and resistance training to achieve greater health benefits. There's been some big scientific studies and systematic reviews that have showed an improved health benefit in pregnancy when combining resistance and aerobic exercise as opposed to just doing aerobic exercise alone. There's also some evidence that adding yoga or gentle stretching can potentially add additional benefits as well.
Recommendation number 5. Pelvic floor muscle training, also known as Kegel exercises, can be performed on a daily basis to help reduce the risk of urinary incontinence. Some studies show that prenatal pelvic floor muscle training can reduce your risk of prenatal urinary incontinence by about 50% and the risk of postnatal urinary incontinence by about 35%. Now, the strength of the studies for this recommendation is weaker than the ones we have done before, but the benefit can be improved by having the proper training in how to perform that pelvic floor muscle training.
Recommendation number 6. Women who experience nausea, lightheadedness, or feeling unwell while lying on their back during exercise should work to avoid that position. Now, this is something that many of you women who are later in pregnancy may know well, in that a large uterus can actually compress some of the blood flow returning to the heart while lying on your back. And so if you're feeling unwell while lying on your back, work to find a new position.
Just because I'm sure many of you are wondering, I want to let you know that physical activity is not associated with any of these negative outcomes. Miscarriage, stillbirth, neonatal death, preterm birth, preterm rupture of membranes, neonatal hypoglycemia, low birth weight, birth defects, induction of labor, or birth complications. So if you don't have one of the contraindications we talked about earlier, don't let the fear of these things keep you from exercising.
Now, if you're pregnant and not currently getting the 150 minutes of recommended moderate intensity exercise each week, that's okay. But the recommendation is that you work progressively towards that goal. If you're one of those amazing mamas who is already really physically active, you're running 5 miles a day, lifting weights, going to spin class, that is awesome. Keep it up.
But also keep in mind that you may need to modify your physical activity as your pregnancy progresses. And there may be times when following those recommendations is just not possible because of fatigue or pregnancy discomforts. So the recommendation is to do what you can and then get back to those 6 recommendations when you are able.
So now that you understand all of these amazing benefits of exercise in pregnancy and know whether or not it's safe for you to do so, your next question might be, well, what exercises should I do?
We want you to know that there's no magic exercise or best exercise. Your goal is to get those 150 minutes of exercise every week, split over at least 3 days of the week. Exercise in pregnancy, easier said than done sometimes. I found for me, if I didn't work out in the morning or early afternoon, it didn't happen because by the end of the day, there was no way I was pulling my buns off the couch. Other things that helped, I got a couple new sports bras to accommodate the girls. I have a support belt, a pregnancy support belt for later in pregnancy when your belly is a little bigger. A lot of my friends have said that's helpful. Make sure you're drinking lots of water. Don't overheat yourself if it's 90 degrees outside. Don't work out outside. And ultimately, listen to your body and try to get that exercise in when you can.
We're sure you've noticed there is an ever-growing market for pregnancy-specific workouts and plans. And while these can be great and especially helpful if you need a place to start, they are not absolutely necessary. Remember, the goal here is to be active and can be as simple as walking on an incline, riding a stationary bike, yoga, Pilates, swimming, combined with a little bit of resistance or weight training.
Now, if you are new to exercise, that's great. You want to start out slowly and then gradually increase the amount you're exercising. Start with as little as 5 minutes a day, and every week add 5 more minutes until you can exercise for 30 minutes a day.
So your body goes through a lot of amazing changes during pregnancy, and some of these are really important to keep in mind when choosing exercises.
Sure.
The first off is some hormones made during pregnancy actually cause some of your joints to be a bit more relaxed. Well, this becomes incredibly important when giving birth to a human a couple months down the road. It can also cause some of your mobile joints to be a bit more loose and more prone to injury. And so for this reason, it's good to avoid jerky, bouncy, high-impact motions if possible.
You're also going to notice that your balance is going to change. You're going to have that change in increasing weight in the front of your belly from that growing belly. And so you're going to notice that your center of gravity is a little different. And so that places new stresses on your muscles and joints, especially in your lower back and your pelvis. So it's a good idea to just be aware of that change in your center of gravity and being off balance. Do some stretching and be self-aware of your body changes.
You may also notice that you're a bit more short of breath than usual as breathing changes during pregnancy. This is for 2 big factors. One is the oxygen demand of your body increases, and also later in pregnancy you're going to have a uterus that's actually getting in the way of taking a full deep breath. So if you're experiencing this, know that it could be very normal.
Now, there are a few exercises you should avoid. For example, you don't want to do anything where you could have contact trauma with your belly. So nothing, no basketball, no wrestling, no boxing, football, nothing like that.
Yeah, giving up wrestling was tough for her. It's also good not to go skydiving unless you absolutely have to.
Avoid anything where you could fall. Again, you don't want to fall on your belly. So no downhill skiing, surfing, riding a horse, etc.
Exercises like hot yoga or hot Pilates are probably good to avoid too, as they can lead to dehydration and overheating.
Yep. No scuba diving in pregnancy.
And also try not to exercise at altitudes higher than 6,000 feet elevation unless you already live at a high altitude.
So whether you are a seasoned athlete or a beginner, these are some warning signs to watch out for when you're exercising, and if you notice any of them, you should stop and call your OBGYN. Things like vaginal bleeding.
Yeah, shortness of breath before starting exercise, or dizziness or headache or faintness during.
Chest pain, muscle weakness.
Yeah, calf pain or calf swelling.
And if you start having regular painful contractions or notice a gush of fluid from your vagina, it is time to call your OBGYN.
So to summarize everything up from this week, being active with exercise in pregnancy is the #1 thing you can do to reduce maternal complications and improve maternal health and outcomes while also helping baby along the way.
You want to shoot for 150 minutes of moderate intensity exercise every week. It's best when you exercise at least 3 times a week and you incorporate cardio as well as resistance training.
So if you aren't active already, start now. Even a little bit now is better than nothing at all.
So that is a wrap for us this week. Hopefully that is everything you need to know about exercise in pregnancy. But if you have any questions or want to know about anything we didn't cover, please leave a comment below. We would love to chat.
And don't forget to hit subscribe to make sure you catch our video next week. We look forward to seeing you guys all then.
Go get a great workout.
Bye, guys. We're doctors.
But not your doctors.
Anything we've said in this video is for education or entertainment purposes only.
It is not medical advice.
Any specific medical questions you have should be directed to your provider.